Americans were forced into social distancing long before the coronavirus. This is an article I'm reading from yesterday, Friday, online. Speaking about the COVID-19 pandemic at Sunday's Democratic presidential debate, former Vice President Joe Biden implored, "This is a crisis. We're at war with the virus. Without question, we have to treat the situation like the acute emergency it is. However, if we don't address structural inequalities in this country, recovery will be uneven and enduring." As officials implore the nation to practice social distancing, we should remember that throughout history, it is that same concept which has made some Americans more vulnerable to the physical and economical effort of coronavirus, as well as other epidemic and disaster. To mitigate the spread of coronavirus, the Center of Disease Control and Prevention is recommending social distancing measures, avoiding mass gathering and maintaining at least 6 feet of distance from other people. For decades, however, Black people and Native Americans have been subjects to a different kind of social distancing in America: segregation, discrimination, and devaluation. These policies, however, which were built on a racial hierarchy, isolated Blacks and indigenous people from closer to polluters and areas more susceptible to national disaster. History has shown that social distancing through racist housing policies such as redlining extracted wealth from communities of color, eliminating a critical buffer against the financial shock of a crisis such as today. COVID-19 doesn't discriminate, but U.S. policy has, in ways that now leave Black and brown people more vulnerable to effect of the pandemic. Segregated housing and schools are a manifestation of the United States' long history of legal discrimination, which has ramifications for our crisis. Redlining was the practice born of a federal back home owner loan corporation, which outlined areas such as size of a Black population in red ink on map as a warning to mortgage lenders, effectively isolating Black people in areas that would suffer lower level of investment than their white counterpart. Far from cure, this form of social distancing creates a social disease that has made many of us sick, literally. According to a 2019 study, residential segregation made Black communities more susceptible to housing closure. Another study published by Medical Care Research and Review in 2014 found that an increase in the concentration of Black people in a neighborhood is associated with a corresponding decrease in an unavailable to surgical equipment. Meanwhile, social isolation through policies, discrimination has extracted significant wealth from Black families. According to the Federal Reserve, most recent numbers in 2016, white family has the highest median family wealth at $171,000. Blacks and Latino or Hispanic family at $17,600 and $20,700 respectively. May these households far more susceptible to pandemic of this scale. According to the Federal Reserve, most recent numbers of 2016, white family had the highest median family wealth. I repeat again, had 171,000. Black and Latino or Hispanic families had 17,600 and 20,700, respectively, making these households far more susceptible to pandemic of this scale. According to my own research with Dr. Ashbara and Gallup Jonathan Rothwell, homes of similar qualities in neighborhoods with similar amenities were 23% less in black majority neighborhood compared to those with very few or no black resident. After accounting for factors such as housing quality, neighborhood quality, education and crime, owner-occupied homes in black neighborhoods are undervalued by 48,000 on average, amounting to a whopping of 156 billion that homeowners could have received if their homes were priced at market price. For life expectancy, money matters. According to the Harvard Gazette, wealthier people live longer, but the COVID-19 pandemic revealed that our fates are more intertwined than we think. Due in part to a lack of access to managerial position, black workers are overrepresented in occupation that require face-to-face contact, such as health care support, personal care, and protective service, as well as gig economic jobs, while businesses in this sector have been rising during the pandemic. The nature of these jobs place workers at greater risk for contacting the virus, with many employers refusing to pay sick leave, while white workers telecommute, receive paid time off, or are otherwise able to both socially distance and remain financially secured. The most vulnerable members of society are forced to choose between their work and their health. This is a structural problem created by the social distancing of people of color. And the more we put these workers at risk of COVID-19, the longer the entire country will suffer. The pro-life ration of the coronavirus forced us to see the inherent connection we share in a way that our public policies have not always recognized. Individual recovering this contingent upon how much we collectively live by the principle of being all in this together. If undocumented residents are sick, the country's citizens will be as well. If Black and Latinos and Hispanic people suffered from COVID-19 effects, so will Asian Americans and white people. This is a structural problem created by the social distancing of people of color. And the more we put these workers at risk of COVID-19, the longer the entire country will suffer. I read this because it's in the writing, but then they put it up in big structure, so I'm reading it according to how I'm looking at it. We're at work with just We're at work with not just the virus, but our past mistakes. Now is the time to create the kind of social safety net that Americans' segregated community never receive. As my booking colleagues Rain Noon wrote, we need a new plan for paid sick leave, policies for food security, targeted support for small businesses, loan forgiveness, and greater increase in unemployment insurance. If we don't address the discrimination that is baked into certain policies, efforts to address this pandemic will be undermined by the past practices that led to such inequality. Even if we heed the CDC advice on social distances, policymakers need to see opportunities to bring historical, defranchised communities closer to the system they've been excluded from. The war against the virus and the war against structural racism can be fought at the same time. I'm just reading this from something. I know some of the words I slip them through because why? English I do speak, but not all the English I do know. I'm putting it just like this for you because the country where I live in, it's not an English speaking country. And therefore, I need to get, when reading, into some of these words. Once again, this is JCon TV out of Zurich, saying unto each and every one of us, walk in peace. And in this time that we are in, please do follow the rules and help each and every one of us to be safe. Wash your hands at all times. Wash it with soap and water. Sneeze into your elbow. Distancing yourself from people so that they don't get sick, not because you don't like their color, their skin color. Help us to help each other. Pray for each other if you believe in prayer. Cherish the other person just like you cherish yourself. Once again, this is JCon TV out of Zurich. Shalom.